University Hospital in South London.
It is loud and clear. COVID is serious.
Okay. The numbers are definitely increasing, and they're still increasing every day.
And I don't think I've ever known the whole system to be as stretched as it is right now under pressure.
This is A&E, but not as you know it. All staff are in full protective equipment. They know that most patients coming in have either tested positive or have symptoms.
How are you feeling now?
It's the breath that's the problem and the cough.
Can I have a little listen to your back? Is that all right?
Shubro is a consultant here.
Just sit forward for me a little and take a nice deep breath.
And he's assessing Hanifa, who's just arrived in an ambulance. She's 42. She tested positive a week before, and her condition steadily got worse.
I felt I was dying. I've been healthy, have any illness, nothing. But COVID just struck me down, just like that.
The sickest patients need to be in intensive care, and staff have to be on constant alert because patients can take a rapid turn for the worse.
It's a very, very sudden thing, and you just have to respond and reassess. And actually that patient looks like whatever the problem was we have sorted.
Staff have noticed that compared to the first wave, the age of COVID patients in intensive care is lower. For example, right here now, there are 2 people in their 30s with no underlying health conditions. The chances of someone under 40 needing intensive care for coronavirus are much smaller than for those who are older. The number of younger patients may be more noticeable because cases have risen across all age groups. Doctors are clear, no one is safe.
And I think, for someone who says, oh, it's a myth or, it won't affect me, then come and see the 30 and 40-year-olds in the intensive care with no guarantee that we're going to be able to get them out. And that's the bottom line, that's how serious it is.
You've seen some in that age group dying, have you?
Yes.
COVID is a multi-system disease, in effect, causing inflammation in all parts of the body, potentially. So we think that it affected his heart.
Alex, who's 32, suffered heart failure after going down with the virus.
My chest just felt like it was getting squeezed very, very hard. I was very surprised that it can do so much damage. I could never think of COVID being that dangerous. So I'm quite a healthy young man, quite active, play a lot of sports, go to the gym, so I was actually quite shocked. I'm lucky to be alive.
Almost half the beds at Croydon University Hospital are occupied by COVID patients. Since the start of the pandemic, they've treated nearly 2,000. But in their catchment area in the southeast of England, numbers are predicted to rise even further.
So I don't know how much more we can do before it gets to there's no more room, there's no more beds, there's no more nurses, there's no more space, there's no more anything. So yeah, I'm quite apprehensive.
Fatigue and stress for staff is more acute, and they say that takes its toll both professionally and personally.
When we came out of the first wave, I don't think any of us thought that we could do this again, and yet we are doing this again. It feels that the pressure is more sustained, and I do think that patient numbers are greater. And I think we're in for the long haul, actually.
Across the hospital, I have seen people struggle. They are tired, but I'm just proud, actually, to see how flexible people have been and adaptable to a rapidly changing situation.
Staff know whatever happens in the weeks ahead, they'll have to be there for patients, coping with whoever comes through the doors. Hanifa did not need to go into intensive care. She's been recovering in hospital. She and those who treated her have one clear message for the public.
COVID is a killer. COVID is real. Please, out there, be careful. be careful. Let's take the precautions seriously. Very, very serious.
Hugh Pym, BBC News, Croydon.